Good afternoon. I'm Jana Martin, Chief Executive Officer of the American Insurance Trust, known to most of you simply as the Trust. We're delighted that you're able to join us, many of you again, virtually today for the second webinar in our special HIPAA webinar series. Today's webinar is being presented by Dr. Stacy Larson, who currently works as a psychologist in the VA conducting disability, capacity, and clinical care assessments and is a consultant to the Trust. Additionally, she is the chair of her VA hospital's Consultative Ethics Committee, conducts monthly ethics seminars for clinical trainees, and supervises trainees in conducting capacity and compensation pension evaluations. We are very fortunate to have her with us again today. So, we want to welcome you again to our HIPAA presentation, and we are delighted to have Dr. Stacy Larson return. And as I mentioned, we do have a part 3 coming up. So check your emails and check our website and the closing comments today, and you'll be able to join us for that, we hope. All right, Stacy, it's all yours, and thank you in advance for what you're going to teach us today.
Thank you, Jana. Welcome everybody who has signed on. Some of you may have joined us last month. Some of you, this might be your first HIPAA webinar. I'm going to go through a couple of housekeeping, and then we'll kind of dive right into things. So first, the required disclosures and conflicts of interest slide. I do not have any financial or any other relationship with the manufacturers of any commercial services discussed in this educational activity. Have to do that. And then the learning objectives, what I'm hoping that we can that I can help with today, and what you all will walk away with is, some ability to identify some potential areas of risk that might be in your clinical practices, as well as applying the principles of a security rule risk assessment to clinical practice, two of the main tenets of the security rule. Before we get started, the slides, they are a little jargon heavy. I'm going to try to use as much layman terms as I can. The slides are word heavy, but I wanted to make sure that information was there. So, hopefully it's a good resource for you going forward. So to start, the first, sorry, excuse me one second. There we go. The security rule, it outlines the steps providers must take to protect confidential information from disclosures through breaches of security. So it does this by addressing specified technical, physical, and administrative safeguards, which we're going to go through today, that you should have in place to prevent that unintended disclosure or loss of protected health information. So a major goal of the security rule is to protect the privacy of individuals' health information while allowing providers, covered entities to adopt new technologies to improve the quality and efficiency of patient care. The security rule is designed to be flexible and scalable, so a covered entity can implement different policies, procedures, and technologies that are appropriate for your size, your organizational structure, the risks that you perceive to your consumers' electronic protected health information. Last month, we talked about the privacy rule, which does protect all individually identifiable health information held or transmitted by a covered entity or a provider or its business associate in any form. So that includes electronic, paper, or oral. So the security rule is the rule that protects that subset of information covered by the privacy rule, which is that identifiable health information a covered entity creates, receives, maintains, or transmits in electronic form. So that's electronic protected health information, or EPHI is a term I'm going to use today. So electronic PHI is PHI that is transmitted or maintained in electronic media. So how we define that is sort of electronic storage material where data might be stored or recorded electronically. So this could be your hard drive of your computer, a flash drive, memory card, transmission of data. What they're meaning is kind of using the internet, sending emails, sending computer faxes, and physical movement of removable electronic storage media. So if you put PHI in a flash drive, and move it to another office, another computer, that's considered that transmission aspect of it's created, stored, transmitted. And then there are certain transmissions, such as paper or voice, which are not considered electronic. However, there's a small caveat. If you have a phone call and you're talking to a person, that's not electronic. If somebody has left a voicemail for you, that does technically become electronic if it's stored on a voicemail system. Paper is not going to be electronic protected health information unless maybe it's a computer printout. So if you got an email or you received an email and you print it out and then put that in the HIPAA record, that email, that initial email is considered electronic. So there's just a couple of small caveats there. We can, but for the most part, things made electronically are pretty clear what is going to be ruled by this security rule or what is going to be governed. So if you trigger HIPAA, you must comply with security rule requirements. Both HIPAA privacy rule and the security rule are triggered. Just to give a little refresher from last month, are going to both be triggered when a healthcare provider transmits health information in electronic form. So that could be transmission via internet, computer generated faxes, putting PHI on a flash drive and moving to another computer. And that has to be done in connection with a designated standard transactions. That's not my term. That is a HIPAA term. But what we have found is the most common transactions that most providers that we've noticed are going to involve requesting or submitting bills to insurance companies. Or if you as a provider contact an insurance company to determine if a patient is eligible or has coverage, or to determine what amount of coverage. Those are things that are going to trigger that sort of HIPAA barrier and mean their HIPAA rule and kind of say you now need to be compliant with HIPAA. So that security rule is scalable in that the Department of Health and Human Services realized that small providers may not have the resources of a larger hospital system. So providers can choose and implement solutions that are reasonable and appropriate for their business. They expect covered entities to kind of analyze their own needs, implement solutions appropriate for their specific environments. And what is appropriate for a particular covered entity, like a solo practitioner, may not be the same as what some is related to a practitioner that maybe is a small group practice that has 4 practitioners. There's different things you have to kind of consider. But the covered entity, you have to decide those measures to use, but the rule allows that flexibility because it doesn't dictate specific measures. It's going to give you more of a framework to work within. So I talked about scalability, and I want to kind of expand about that a little bit. So the security rule is based on 3 different principles. There's scalability, comprehensiveness, and technological neutrality. It's a bit of a mouthful, but scalability is, it was put in place to make sure that the security rule can be effectively implemented by covered entities of all types and sizes. That comprehensiveness aspect refers to the fact that the security rule addresses all aspects of security. So we're going to be talking about data integrity, availability, ability to maintain confidentiality. And then that neutrality aspect is that the security rule does not define those specific technology requirements. Like I mentioned, they're more of a general framework that they want people to work in. Technology is changing all the time. I don't know how many people on here may have had a MySpace account. Now they have a Facebook or something like that. Technology changes daily. It's constantly evolving. So to put a technology or a specific technology in the rule would have already dated the rule badly. So they've just never gotten into that sort of level of specificity. It's more about people doing what they're supposed to do. It's going to be focused on PHI when it's maintained in your computer, transmitted through a network, or on the other electronic media. And so it kind of maintains standard safeguards from unauthorized access, alteration, deletion, and transmission. So when we talk about that scalability, you should be able to fit the security rule to your needs, whether you have a small office or a large clinic. It's really emphasizes trying to be reasonable and appropriate. And so the security rule specifically provides factors to be considered when determining which measures to be used. So those measures are the size of the practice. Like I had mentioned earlier, if you have one provider versus 10 providers, or one provider with 3 staff members, and that sort of thing. So it kind of depends on the size and as well as the complexity. If you have a large billing department and a records department and several providers and several ancillary providers, that's all going to kind of play into this, as well as the capability of the practice. What level of security factors or security measures can you manage as a practice? Technical infrastructure is something they're going to look at. That's computers, laptops, tablets, cell phones, costs of a procedure, costs of implementing security measures, and then that probability of potential risks to EPHI. Security risk could be inadvertent access of PHI. It could be a person deliberately accessing PHI that they shouldn't be. It could be a hacker coming in. It could be an internal where you maybe have a staff member. Those are those different risks that we have to kind of consider, and we'll talk about those more as we go into it. One thing about cost that I want to talk about is the security rule guidance kind of cautions that cost is not meant to free providers from inadequate security measures. So yes, maybe this option of an EHR is out of the budget for the practice, but maybe a more simplistic EHR would be within the budget. So they do want to take that into measure, but or into account, but they're not going to, HHS is not going to necessarily say, oh, it was too expensive, then you're fine. You have to show that you actually considered some other options. And this, I say this all must be documented in a risk assessment. I am going to go into that further a few slides down, but I wanted to kind of start here. Like the security rule specifies that you must conduct an accurate and thorough assessment of those risks and vulnerabilities to the confidentiality, integrity, and availability of the practice or the PHI that your practice holds, and implementing those measures that are reasonable and appropriate to reduce the risks and vulnerabilities to an acceptable level. Sorry, forgive me for that. So this is kind of the bread and butter of the security rule. So the security rule is made up of 3 standards, and underneath those standards, there are required and addressable implementation standards within each one of those standards. I'm not going to get into that level of granularity here because it's just going to be a little bit overly confusing to do that. And some of the things further on that we can talk about, but I'm going to definitely give examples here, and we're going to walk through these kind of step by step. So covered entities are required to comply with every security rule standard. So there's 3 of them as listed on the slide: the administrative, the physical, and the technical standards. And then within those, they have addressable, which means that they're optional. Addressable is the word they use, while others are required. And those required specifications have to be implemented. As I said, the addressable, it's optional, but it often is something that you might want to consider. And they're definitely just trying to make sure within that framework that they're not leaving anything out within that broader sort of skeletal framework of the security rule. The covered entities are allowed to determine whether those addressable ones are reasonable and appropriate for that covered entity. If not, you can adopt an alternative measure that achieves the purpose of that standard. Like I had said, they're okay if I can't do this one because it's too expensive, but maybe this is an option, or if there's another way that you can kind of meet that rule, that's what they kind of go for. So I'm going to kind of walk through the 3 standards now and kind of pick out some of the bigger parts of it in an attempt to kind of explain how they apply to your practice. So administrative standards, that's kind of that implementation of office policies, procedures, training of staff, processes to ensure security requirements. So what you're going to see here is this is where you kind of do your security management aspects of your security rule. So this might be where you would document your risk assessment, your identification and analysis of potential risks to electronic protected health information, the ways that you're going to implement different security measures that reduce risks and vulnerabilities to a reasonable level. There's no way that anybody is going to make their practice completely free of any risks. Risks is just a part of life, unfortunately, but they want it to get to an appropriate level. They don't want unnecessary risks happening. Part of administrative standards as well would be designating a security official who's responsible for developing and implementing security policies and procedures. This could be in an individual practice yourself, as simple as drafting up a little policy where you say, I am the security official for this practice. The administrative also would have information access. So that's consistent with the privacy rule standard, which limits uses and disclosures of PHI to minimum necessary. So the security rule requires a covered entity to implement policies and procedures for authorizing access to ePHI, only when it's appropriate based on the user or the recipient's role. So for instance, in a practice, it might be necessary for Dr. Jones to have full access, of course, to the clinical record. But maybe Stephen, who is the associate working at the front desk setting the appointments, just needs access to the names and a calendar for appointments. They don't necessarily need access to the full record. That's what they mean when they talk about access management, to make sure that it's role-based and that access granted is appropriate based to the specific role. Another aspect of administrative standards, that's where training comes in. So covered entities must provide for appropriate authorization and supervision of workforce members. So you must train your members regarding policies, procedures, and show that you can apply appropriate, I hate the word sanctions, but sanctions or repercussions, I guess, if a workforce member does violate the policies and procedures. We've seen it in the news, unfortunately, where sometimes staff may access, let's say, a celebrity's record when they shouldn't and things like that. And there's got to be some sort of plan for if that happens. But the big thing is just making sure that staff are trained. Most staff are all trained up in HIPAA. They've kind of been living and breathing it. But when you switch between practices, those sort of policies can change. Somebody coming from a large hospital practice to a smaller mental health practice, the different standards, while the standards stay the same, the different ways that the practices implement those standards may change. So it's always important as new staff are coming on, as there are changes, that staff are constantly kind of kept updated with that, as well as the owner, the main provider of the practice. It's kind of on you to, take part in trainings like these and to kind of try to stay abreast of these things. And then that risk assessment, which we'll be talking about shortly, would also kind of fall under that administrative standards, sort of this assessment of how you're going to implement security policies to meet the requirements of the security rule. So physical standards, the second sort of main aspect of the security rule, is limiting access to the physical area where information is stored. And what do we mean to this? Basically, that is sort of along with the lines of the role-based access that's also here. So limiting physical access to facilities while ensuring that authorized access is allowed. So yeah, this is more of the physical. So maybe, Barbara doesn't need access to certain offices, only this office, or maybe Barbara needs only access to certain aspects. It's kind of who is allowed to access what information, where in the facility. And this is often seen a little bit in maybe larger facilities than in offices that are smaller, but it's definitely one of the aspects that they consider. And they also talk about workplace and device security under physical standards. And what they mean by that is implementing policies and procedures to specify proper use of and access to workstations and electronic media. So This could involve workstation privacy, maybe using privacy screens or changing the directions a computer faces to ensure that there's no inadvertent viewing of EPHI. For instance, a provider sitting with their back to the door with a computer and a patient walks in and they're able to see the computer screen. Those are things that you're considering when it comes to that aspect. You also want to have policies and procedures regarding using electronic media, transferring it, removing it, anything that has to do with like the physical aspect of kind of moving it from one place to another. If your practice has laptops or tablets, are they allowed to be used out of the office? Are they only in the office? Are they only for providers' use? Can they be used by the provider's 7-year-old who needs a distraction on the car ride? Those are things that kind of come into physical standards. And then technical standards is related to sort of that transmission, authentication, and security issues that may arise. And that kind of comes with the aspects of a covered entity implementing those technical policies and procedures that allow only those authorized persons. So this could be as simple as ensuring that every staff member in your office has a different login or sign-on code, and that people don't use each other's information to log in. That kind of gets at an issue of access. So you need to know who's accessing what and when they're accessing it. And if people are sharing codes, you can't tell if it's Stephen or Barbara who had logged in at a certain time. And you also are going to want to, under those technical standards, have audit controls. So implementing some software or procedural mechanisms to record and examine access and other activity in information systems that can contain or use electronic protected health information. So if someone is inappropriately accessing PHI, having an audit system like that would allow for a provider or a covered entity to discover that sooner rather than later. Integrity controls are also under technical standards, and that's sort of implementing those policies and procedures to ensure that electronic protected health information is not improperly altered or destroyed. Sometimes it's a little easier to change electronic data than it is to change paper data, and that's kind of why I think this is in here. And then the transmission aspect is sort of that you're not are guarding against unauthorized access to EPHI that is being transmitted over an electronic network. So ensuring that the people who need access have access. This is sort of protecting you if you are emailing things or sending things to other people, kind of protecting you from that aspect of how you're going to make sure that that information stays protected while it is being submitted that way. So security rule compliance. So in order to show compliance with the security rule, providers must conduct a risk assessment of all potential risks and vulnerabilities in the practice. So you're going to want to consider your email system, your storage system, whether it's electronic or paper. Like I said, HIPAA security rule only governs the electronic storage, but because of the privacy rule, you will want to consider protecting obviously the paper records as well that you might store in your office, training of staff, different things like that to consider. And so the risk assessment takes into account those security rules and standards just mentioned, sort of the administrative, physical, and technical, along with those goals underneath them, which are required and addressable, and how they are applied to the clinical practice. So this may be very different for every practice. One security risk assessment might be very different for this practice than another. Hence the desire for the security rule to be scalable and flexible to ensure that all providers can show compliance with the security rule within the general framework, rather than specifically requiring any technology or specific resource. So providers are going to do this risk assessment, and then based on that risk assessment, select security measures to implement and meet the security rule standards. And we'll talk a little bit more about that. So once you do that risk assessment, you implement those security measures and document them in a written security plan. This can be written on paper, this can be written electronically. It's just, you want to be able to have a document that reasons why a measure was or wasn't adopted. I used the example of an electronic health record system earlier. It might be that, you know, an electronic health system with all the bells and whistles is just not an option for your practice, but maybe an encryption software is something that would be more applicable for your practice. And so you would want to document the reasoning for why that measure wasn't and was adopted. And then that assessment, you're going to want to periodically review and make changes as necessary. Changes could be coming up when maybe a provider leaves a practice or a new rule comes out. HIPAA, there's a rule pending. It doesn't have a lot to do with security. It's more about privacy. There's a rule pending. It's been pending for about 2 years. So there might be some changes coming that way. The unfortunate death of a provider and kind of how you deal with that PHI, that's kind of, those are those big changes. Or if you've had a breach and somebody inappropriately hacked into your system or accessed records they shouldn't have, those sort of issues are when you're going to want to revisit your risk assessment. So the bread and butter, what is the risk assessment? So the covered entities are required to perform this routine risk analysis. And it takes into account those standards and the potential risk of each PHI. So now the risk analysis will include an evaluation of the likelihood and impact of potential risks to ePHI, implementation of appropriate security measures to address risks identified in the risk analysis, documentation of those security measures and the rationale for adopting or not adopting the measures, and then that maintenance of continuous, reasonable, and appropriate security protections. So you may be asking, how does a small provider even start? Where does this even go? There are, I'm sure, companies out there that may help your practice set up a risk analysis, but it could be expensive, not always the best option for providers. I have found that the Department of Health and Human Services has developed a web tool, which I find very helpful and user-friendly. We're going to talk about that next. Probably because they saw this as a potential issue, and they also want to make sure that they are supporting providers. The Department of Health and Human Services has set out a lot of guidance about these things, and I think they developed the security risk assessment tool to allow covered entities to test whether they are complying adequately with the security rule. And it kind of walk you through those steps that you have to do, because it is a very technical and long document to follow through. So as I mentioned before, this is an ongoing process. You're always going to want to regularly review records to access ePHI and detect security incidents, periodically evaluate the effectiveness of your security measures. So you might want to check in those audit controls, or check in one day and see, okay, who has accessed what, these sort of random peer review checks and things like that, and reevaluate for potential risks to ePHI. So the risk assessment tool that I mentioned, is available at the website you see here. And it's a downloadable security risk assessment tool. It is meant for small and medium-sized providers. This is not meant for larger hospital systems. But they developed it to kind of walk people through security rule and ensure that there is greater compliance with the security rule. So it's a desktop application. And I was going to try to put a couple of screenshots up here of this, but I couldn't quite, my own technological difficulties, I couldn't quite determine how best to frame them. And I realized that it's probably not helpful to see. I'm going to walk you through a little bit. I'm going to talk you through a little bit of the tool, but I definitely encourage people to click on this link and kind of walk through it. It is a desktop application that will walk you through the risk assessment process. It uses multiple choice questions, threat and vulnerability assessments, and different things. It's going to ask you questions. Most of it is multiple choice. And then it gives references and additional guidance along the way. So sometimes based upon your answers, it might suggest this or that option. At the end of it, well, I guess, let me go back. It's installed on computers. obviously, but all information entered into the tool is stored on the user's computer. So it stays on your computer. No information is being sent to Department of Health and Human Services. They're not collecting or viewing or transmitting any information entered into the SRA tool. It truly is a downloadable program that you put on your computer, fill in the information. It will give you a report that you can print up and save, and then you can do it again when you need to, when there's a inadvertent disclosure or a big change in the practice or a new rule comes out. I will say the tool was recently updated, and Department of Health and Human Services, January actually 2022. The department has indicated that they plan to continue to provide this tool to help providers ensure compliance with the security rule. It does take a little bit of time, but it's very manageable as a way to kind of walk through those things when you're considering a risk assessment. And I think what we'll talk about now is kind of different threats and things to consider when you are kind of training, walking through these sort of aspects of your practice. So potential cybersecurity threats. We've all heard and read those stories of email phishing attacks, ransomware attacks, and kind of they're rampant, unfortunately, right now. They're kind of everywhere, and there's no predictor for who might be taken in by one of these. No, it does not depend on age. I mean, I know a lot of people think it has to do with technological savvy, but people who are, technologically savvy can still get taken in by these phishing attempts. And so things to kind of consider with those email phishing attacks and those ransomware attacks. You're going to want to make sure you train your staff to check embedded links in emails. So verify that the URL and the link match. It's really important to closely look at the email address that sent the email. So, for example, an email from Lowe's Hardware store with the letter slightly changed. So rather than from Lowe's, L-O-W-E-S, it's from Lowe's, L-O-E-W-S. Or clicking on the details when you've got that email and it says from Bank of America, and you click on the details and you realize that it's Bank of America from, but the email it says is like abc123@gmail.com, which is not likely to be an email that Bank of America would use. But the hackers that use these sort of attempts to kind of get that protected health information are very savvy, and they will hide these little things and kind of suspicious from addresses, sending emails that are like urgent, you need to respond now, or that, like I said, where the URL and a link don't actually match. Like it says you're going to Zappos, and instead when you look at it, the link is sending you to some third-party website that has nothing to do with Zappos. So those are kind of things to consider about with ransomware attacks. If your staff, you want to train them to kind of identify that's a risk that to PHI. Generally, these ransomware attacks, these phishing attacks are attempts by a hacker to get into your computer system and potentially take the PHI of providers. They don't know exactly what they're getting. Sometimes hackers will reach out to people and just hope for the best that they're going to get stuff. And health records have a lot of information that could be, utilized or valuable to hackers. It's not always about getting that banking information. So as providers, you may have birth dates, marital names, addresses, even social security numbers, etc. So you have a lot of, pretty important information on people. And so sometimes hackers will want to use that to steal identities and things like that. This is a broad case example, but I wanted to kind of show that this is one way that there is a potential cybersecurity threat, and it's becoming more popular to kind of do that. There's also the cybersecurity threat of loss or theft of equipment. So in this instance, maybe you're at a Starbucks or a coffee shop and decide you're going to use the restroom, and when you come out, the laptop is gone. You know, we've all been there where we're like, I'm just going to run to the counter and get a refill. And, you know, there's nothing necessarily wrong with that, but to protect from things like that, or you left your laptop in your car and somebody stole your car, or you left your cell phone in a cab, that sort of thing. So how do you protect against those cybersecurity threats? Having the equipment encrypted. Encryption means that only the person with the encryption key can access it. So if you as the provider have the information encrypted and you have the password, the passkey, whatever term you want to use, you would be able to enter that information and see the record. Anybody else trying to see the information would see letters and numbers or gobbledygook or just a series of symbols. It wouldn't make sense to them. That encryption makes the information in the system unreadable, which is why it protects if it's stolen or lost. It gives you that level of protection that the PHI, while it might be out there, is not readable by anybody else. They can't use it to harm anybody else. When we talk about kind of not storing PHI directly on equipment, that's going to be helpful in a number of different scenarios. So like if you're storing the PHI in a cloud, then the information is always going to be available to you if the device is stolen. Let's say you're in a flood or a fire and device is destroyed, that information is still going to be available to you, which is very important under the security rule. They want the information to be, you know, confidential, meaning you're protecting it the way you should be, but it also needs to be available, meaning that you can access it when you need to. Some people don't like the cloud. Some people will use external hard drives or flash drives. But if you're doing that, you want to also make sure that you are protecting that wherever it is. So if it's in a lockbox or somewhere else like that, that it's not going to be destroyed or lost. And a big one when it comes to like protecting information from loss or theft is making sure you log out of the equipment when you're not using it. Some ways to do this would be to consider putting in audit controls so that if your system realizes, oh, nobody's been doing this one for 5 minutes, nobody's been working on this computer for 5 minutes, I'm going to shut off, I'm going to lock. Then somebody has to lock in, or actively telling your staff that they need to kind of log out when they're done with their equipment, not leave it sitting there so that they're, you know, again, 7-year-old can come over and get on mom's computer and, you know, play Minecraft and inadvertently at the same time, you know, see PHI. Now we're not too worried about a 7-year-old seeing PHI, but if you're a rural psychologist and you have a teenager and they're in there, you know, accidentally get in there and they see, wait, my mom's friends, that could get concerning. So we just want to make sure that when you're not using your system, you're accessing it to kind of make sure that it's closed and not anybody else gets in there either. When it kind of comes to those cybersecurity threats, it's important to think about how the data is stored on your system. So there's kind of data at rest, which we've talked about, and then data at motion. That data at rest it's just stored. It's not being transferred from device to device. And that data in motion is moving from one location to another. So that's emailing it or using a flash drive and moving it from one to another. Data at rest is less vulnerable because it is stored within your computer. It's kind of there, but that is the data that it can be often more attractive. You know, you see large cyber hacks because there's a lot of information in those data sources. And so that's when providers are encouraged to utilize firewalls or that antivirus malware. Data in motion may be more vulnerable because it can be transferred through potentially unsecured channels. And that's when providers will want to kind of consider encryption products and software to make sure that they are protecting the information even when it's in motion if they can. So some examples of different security measures that providers can use. We talked about kind of those risks, those different areas of risk and needing to kind of be aware of where people are, who's accessing, that sort of thing. But some examples of different measures that providers can do is looking at encryption, which is, as I said, that act of ensuring that the information is not readable unless you have the appropriate encryption key. And that can be done using external hardware that has encryption installed on it. So you can buy flash drives, you can buy external hard drives that have encryption programs on them so that when you save information, it's encrypted onto that flash drive. Or probably purchasing different email products that allow you to email encrypted PHI to patients, providers, and other insurance companies. Minimum necessary, we had mentioned that earlier, or I had mentioned, not the royal we, I had mentioned that earlier. The process of only supplying the information requested. As I mentioned in the privacy webinar last week or last month, it's important to look at the request in that sort of request for information and respond to the true language. So for instance, if a request comes through for the past 6 months of records, only send the last 6 months, even if you've been working with the patient for several years. Or if the request comes for records of the patient with Dr. Jones, send the records for Dr. Jones, but not Dr. Allen, who is now seeing the patient because Dr. Jones left the practice. It's really about making sure that you are responding to that request and not going above and beyond. That minimum necessary is the best way to protect that patient privacy. Again, the access controls for staff. Do all staff need access to certain records? Staff should have unique logins and passwords for the system. Just setting those protections up as you need. Staff training, I can't say it enough. I think it's probably one of the biggest aspects of HIPAA compliance, both privacy and security rule. It's really important that staff receive training in HIPAA compliance and the policies that you use in your office. It's important because not all offices are going to use the exact same procedures for compliance. There's that scalability. So it's really necessary to ensure that staff understand how your office applies the HIPAA privacy and security rules, what your policies and procedures are, how you respond to different things, how you respond to requests. This is going to really become in handy or become very important when it is patients requesting their records or requested information or right of access. It's important that staff know patients get access to their records. And so under staff training, you make sure that they know patients get access. This is how long. We have 30 days. We have 45 days. Truthfully, 30 days is generally the standard to get them the records. And we can't deny them unless this, and this. And so it's really important that staff understand that. And then that proper training about utilizing technology. Do staff have laptops or cell phones? Like if you have a smaller practice and you provide those for your staff, do they use those offsite? Are they only used on-site? Are they trained that they should lock them if they walk away from a computer at home? Or, you know, in the case of theft, or like what they should do if they lose a laptop? Hopefully they would come and tell you and not just hope that nobody notices. It's very broad, the training that you want to do. It could be as simple also as kind of the best ways to maintain contact information on your cell phone. Maybe you don't delineate people as patients, but figure out another system to do that so that if the phone is lost or stolen, it's not possible for the potential, you know, thief who might have taken your information to differentiate a patient from a family member. Everybody is just kind of listed in a certain way. And so you wouldn't want to say patient X, patient Y. It might be A, B, C, D, or you might have your own system, but kind of not making things stand out too much when it comes to contacts in a cell phone is an easy, sort of relatively simple training method that can happen. And kind of, I want to come back to sort of the main points of the security rule. I realize I'm trying to shove a lot of information here. The main points, it wants to ensure the confidentiality of ePHI. So that's the equivalent to the concept of privacy under the privacy rule, that the electronic protected health information is protected from use by or disclosure to unauthorized individuals, entities, or processes. Ensure the integrity of the information so that the data is being stored or transmitted in valid ways. protects against risks, unauthorized modification, insertion, or deletion of data. And then obviously availability, which we kind of talked about, that it's accessible and usable upon demand. Availability is kind of concerned with threats ranging from denial of service to data loss through things like equipment failure, disaster recovery. It involves kind of planning ahead to make sure the data is available when needed. The big thing is you want to make sure that it's accessible and usable, and not altered or destroyed. Part of the security role is that conducting the risk assessment. That's going to walk you through that tool that I talked about on the Department of Health and Human Services. We'll walk you through those 3 standards: the administrative, physical, and technological standards, and the required and addressable guidelines underneath that. It'll walk you through all of that and kind of help you develop that plan. You need to conduct a risk assessment if you are a HIPAA compliant entity. And then adopting those reasonable and appropriate safeguards, which will come from the risk assessment. The risk assessment will help you kind of determine what options you need, what things you should do, whether it be encrypted email, appropriate staff access, you buying an EHR with all the bells and whistles, encrypted laptops, kind of that will help you develop plans. It's not going to tell you what to do. It definitely is working in conjunction with what you tell it you have, what services you have, what things that you can foreseeably do. Documenting those safeguards you've chosen. So that's kind of printing out that plan or saving it on somewhere on your computer, your cloud, that you have it, and indicating why you've chosen some things and why you haven't chosen others. And then maintaining those security measures. Ensuring your workforce complies with them, they have knowledge of them, and then periodically reevaluating that effectiveness of the plan that you have in place. Technology changes frequently. So it could be that what you have effective tomorrow might not be still usable in a year because technology has changed. So you want to kind of just reevaluate. The tool is always going to be there. Like I said, HHS has given no indication that they plan not to take it away. And I find that that is the easiest kind of way to walk yourself through that compliance aspect of developing that risk assessment. And with that, I'm kind of at the end. I realize I have given a lot of information. So I'm just not sure. Questions or comments?
Oh yes. There are lots of questions. So why don't we tackle a few?
Okay.
There have been a bunch of questions about email and security and
Yes.
which emails are encrypted and which are not. So I'm going to read you one question and then add to it. How do I communicate securely with email with patients? We send a link, but patients prefer Yahoo email to the secure email I have, saying they can't open the link. And then there was another question, is Gmail encrypted? And if not, what is?
So that's kind of a couple of different questions. I'm going to kind of come at it from a couple of different angles.
Sure.
So patients can send you information any way that they want. They are not covered entities. So if they want to send you an email, it is, once you get it, it is protected health information, but them sending it to you is not. And so then it becomes a discussion with the patient about sort of the security of emails and what you are comfortable with. Some providers may be comfortable with their patients emailing them. I suggest that if your patients are going to email you, when you respond, you remove their message. So you are just saying, and maybe your response is, thank you for this. We will discuss in our next session. You know, you keep that to that minimum necessary of that response. So that's one aspect of emails. Patients, if you explain to them, or I shouldn't just say patients, but consumers, I guess, if you explain to them the risks of kind of using unencrypted emails and things like that, they can choose to opt in that they want to get emails from you. You're going to want to document that. I believe the risk assessment tool will kind of talk you through a little bit about that. But they can say, you know what, I'm fine with that. I accept the risks. I want you to do that way. I still say minimum necessary. But then you can use that as a communication. For emails, Gmail is not encrypted. Yahoo is not encrypted. There are different emails. If you search, and I at the top of my head, I can't think of any specific, but there are different email platforms that you can, utilize. I mean, obviously the links, as the provider who said they try to send them the links, should work. But if the patient says they can't, they can't.
Yeah. And certainly one of the things you talked about, informing the patient and client about the risks, it's best if you do that and have them sign something.
Yes.
That you have a consent form of sorts, that in which it is clearly stated that you went over this information, you've gone over the risks as follows,
Yep.
And that they are making the choice, even with that knowledge, to continue to send you information in an unencrypted way.
Yeah, and you'd want to document that in your risk assessment. You would say that this is the policy, this is what we're going to do. And then in each patient's record, if you do that, you'd want to keep a copy of that form to show that they've allowed you to do that. Yeah.
Great. All right. If the client submits to their insurance company and the provider is out of network, does that trigger the HIPAA security rule for the provider?
So in that instance, I'm going to assume that the provider is just providing like a bill that the patient is then submitting for reimbursement directly to the patient.
That would be my assumption. I don't know, but yeah.
Technically, no, you probably haven't. But it's still, it's become such a gray area. But no, I would think you haven't kind of triggered it in that context. But what it might trigger is that the insurance company reaches out to you, and then if you talk to them about anything, then you know what I mean? You've kind of inadvertently become that way. So if you are not billing, and I should say, if you bill any one patient,
right,
your whole practices. So if you're sending like 60 or 98%, I give them their bill, they submit for their own reimbursement, but that 2%, it doesn't matter, the whole practices. But you should be, I'm a little nervous of saying yes and no, because HIPAA kind of is a moving target. But yeah, if they are submitting and you're not contacting or doing any sort of data transmission with the insurance company of electronically, then theoretically you would not need to be compliant with HIPAA.
Right. Okay. So now this also deals with insurance companies, but a little bit different. Can you speak to the issue of health insurance companies requesting records for standard spot checking audits? I have resisted these, insisting they first get and send me the patient's written permission, that they specify which information they need, reducing the request for all records down to a summary of dates of service and diagnosis. Have patients effectively signed off on their privacy from insurance companies by signing up for their insurance?
So yeah, unfortunately, this is another one of those areas that a lot of people, there's a lot of small print when you sign up for insurance. And one of those documents, I believe, generally says that we have the right to kind of request information and things like that. Now, as a provider, you can tell an insurance company, I would like a release and things like that, and go from there. But I don't know how successful that always is. Audits is a much broader thing that I'm not as well versed on. Some of my colleagues at the trust and other places might be more versed with the audits issue, but yeah.
Yeah. Okay. Thank you. Here's another one. My computer guy, who is HIPAA compliant, mentioned that a complete wipe of my computer is not necessary if I have it fully encrypted. This is for my old useless computers. Is this true? It makes me nervous to take these to the place he mentioned without doing the wipe.
I mean, if your computer is fully encrypted, that would mean that somebody wouldn't be able to view that information. But at the same time, I don't see why you wouldn't just want to wipe it. I mean, even if I was taking my personal laptop, I'd want to completely wipe it before I took it to somebody else to repurpose. So he's not incorrect, but I would go the further step of clearing everything off.
Right. Yeah. What about when PHI stored in the cloud gets leaked or hacked? Am I responsible for the data breach as a clinician?
It would depend on a few things. One, is it your data that's hacked? And two, what the sort of business associate agreement that you have with the cloud company, the business associate is. Generally, the business associate is under the obligation to notify you, and then you would, and HHS, and then you would also notify HHS. And then that triggers that sort of next set of requirements. So I think it's still kind of, if there's a bad actor and you've attempted to the best of your ability to ensure that the information is secure and encrypted and everything in the cloud, and if it's leaked encrypted from the cloud, they're not going to be able to do anything with it anyway. So encryption is always going to be your best, but
the safest route. Yes.
Yeah.
And then here's a related question: is password protection enough to protect PHI on computers and iPhones?
So I would say, again, encryption is always the gold standard. But if encryption is something that is just not achievable, like when you're going through your risk assessment, then I would say password protection is definitely a secondary good measure. But you want to make sure it's a very complicated and difficult password. You don't want it to be password 1234. It needs to be something that is not easily guessed, something made up of, maybe a phrase made up of numbers, letters, and symbols. But it should be something complex if you're going to use just a password.
Right. And I would guess you would also have to justify why you chose that instead of full encryption.
Yes.
Yeah. And then we've got time for one more. Are there differences in this rule and staff training when staff are W-2s employees versus contractors?
I would say no. I think if they are working with you, and you are paying them, even if they're a contractor, it's in your best interest to make sure that they are fully trained with how your practice manages HIPAA, because you want them to be following your practice lines as a contractor or a W-2 staff.
Wonderful. Well, thank you for answering these questions. Of course, we have many more. We just have run out of time. But I want to thank you on behalf of the trust and the audience, and as a professional myself, for your wisdom and sharing with us all that you did. It is a lot of information, but we appreciate your sharing it with us.